Can you hear me?
Yes.
Perfect. Thank you so much. It is now 1 p.m. We are officially starting this afternoon session. Before we begin, if you'd like to take a moment to scan the QR code to make sure helps us to see how many people participated. I'm so happy that you made the time to join us today. Thank you so much for being here. I hope for those of you that were able to join us since the morning time, that you've enjoyed your day so far. This day is for you. Thank you for being a family caregiver and doing everything that you do to help support the person that you're caring for. This is from Respite to Resources, connecting with local programs. This session was made possible through the generous support of our partnership with Independence at Home, who is one of the lead sponsors for the CALM conference. Thank you everyone for joining us today, both in person and online. We're so excited. This is our first conference back in person after not being able to join for 5 years, due to the situation we all encountered. So to have it here today in person and to be celebrating our 25th anniversary makes it extra special for us. And I hope for you as well. My name is Veronica S. Perez, and I am the Senior Family Consultant here at the center, which also is known, it's USC Family Caregiver Support Center, LACRC, the long name, Los Angeles Caregiver Resource Center. Our center, provides free services and resources for family caregivers throughout LA County, including individualized care planning, support groups, educational workshops, and when funding permits, some respite. In the following table, you will find more information about our center services. Our goal is to ensure caregivers feel supported, informed, and empowered in their caregiving journey. So how we do that, we have assessments that we do one-on-one with the family caregiver. We help with case management. Many of you have a family consultant that's working one-on-one with you. If you do not yet, and after today, you're more interested in maybe obtaining your own family consultant, please check in with our resource table in the front. We have specialized information depending on each journey is individual and unique. So we'll do our best to tailor it for you, for your needs. Counseling, we sometimes refer out, or if we can do in-house. Legal and financial planning, very, very important. When there's funding available, that's something we can help with. If not, we refer out. But all of that gets addressed with the family caregiver when you speak to a family consultant. And lastly, again, depending on funding, if there's an opportunity to help with additional support, then we will discuss that. So our next speaker, Ms. Andrea Spencer is the Social Services Supervisor with Los Angeles County Department of Public Social Services. She oversees the IHSS intake social worker team in the Region 4 Torrance office. And she has worked for 40 years in her career as in the county service. She has served in multiple leadership and frontline roles, bringing deep knowledge of social services and strong commitment to supporting vulnerable populations. So thanks to the work that she and her team are doing, many of the clients are able to stay home with support where they want to be. It is not an easy job. There's a lot involved, and we're so thankful that she's here today to speak to us a little more about IHSS.
I'm gonna try to stand up. I have two low knees, so it doesn't make it very easy for me sometimes. I am going to attempt to do that. So as Veronica says, I am an intake supervisor with in-home supported services, and I've been with in-home supported services now since 1998. I started off as a social worker trainee, and then I was a social worker, and I became a social services supervisor. So I have, at the present time, I have 6 social workers that I supervise, and they go out in the field to assess the needs of the elderly and disabled individuals. So basically, I just want to give you a little information about IHSS. Right now in the state of California, we service about 600,500 recipients. Los Angeles County has the largest number of caseloads. Our social workers, my intake workers, they get anywhere between 40 and 50 intakes a month. The approved workers who handle the cases after the intake workers have gone out to see the recipients. Right now, their caseloads is over 500. Jesus. Now, they have to go out and see the consumers every year. They don't have to see all 500, but right now they see between 50 and 60 people a month to make sure that they have the correct amount of hours that they need to be able to remain in their home safely. The IHSS program we work with. Okay. The IHSS program, we work with the California Department of Social Services, which is also known as CDSS. We work with the Department of Healthcare Services, which is DHCS. We work with the public authorities. We work with different program advocates, as well as providers and the employee unions. So we work with the unions as well that services the IHSS provider. There's 4 IHSS programs since I began with the program in 1998. They have increased the program. So we have the IHSS residual program, which began in 1974, which is when IHSS began. And that program was basically funded by the county and the state. In 1993, we added on the personal care service program, which we call PCSP program. And that program was the first federal funded program that IHSS received. We have the IHSS Plus Option Program, and then we have the IHSS Plus Waiver Program, and now we also have the Community First Choice Option, which we call the CFCO program. So basically, I want to tell you about the eligibility criteria for IHSS recipients, and it's pretty much almost the same as MSSP. You have to be you have to reside physically in the United States. You must be a California resident. You must have Medi-Cal eligibility. You must live in your own home. And your own home can be anywhere of your choosing. It can be an assisted living facility, it can be in your relative's home, but you have to be in your own home. You cannot be in a board and care facility. You cannot be in a nursing home. You have to be in your own home, and you must have a healthcare certification form completed by your doctor in order. So when you call into IHSS and you make an application for service, you're automatically sent a form that you need to take to your doctor to have completed. And you have 45 days to get that form back to us. And if you don't get that form back to us in 45 days, the case is denied. We provide services for elderly and disabled, such as house cleaning, meal cleaning, laundry, grocery shopping, personal care services, which would be your bladder care, your dressing, your bathing and grooming. We also offer paramedical services in which if you need to have insulin injections, we will pay the care provider to give you your insulin injections, as well as do any other care that needs to be done, tube feeding. So our program entails quite a bit. But in order to get certain services, we do have to have authorization from the doctor. And so at the time, after you make this, application for service, like I say, you have 45 days to get your application, your medical certification in. We do not assign it to a social worker until that medical certification comes in. So sometimes it could take up to 60 days or so before you actually see a social worker, or a social worker actually comes to your home to conduct the assessment, because we have to wait until we get that form back from the doctor. And if there's 4 things on that form that has to be checked, and if there's anything on that form that says no, then we're not able to provide service. So once we get that form completed, the social workers will come out to your home and they will assess what the need is. I heard the MSSP worker, she talked about the share of costs. Now, in some cases, we do have a share of cost in IHSS, depending on if you have a Medi-Cal share of cost. So if you have a Medi-Cal share of cost, then you would be required to pay a share of cost to your care provider. And that could be a pretty large share of cost. Medi-Cal makes that determination. IHSS does not make that determination. A lot of times people think that IHSS makes the determination, but we do not. And so if you don't agree with your share of cost, we will refer you back to Medi-Cal so that you can negotiate with them and see if there's another program, because there are other programs that Medi-Cal can put you under that would bring either your share cost down, or it may eliminate the share cost altogether. My social workers are very busy on a constant basis, and we have a lot of time. The care providers or the consumers will call and they're upset because they can't reach the social worker, and that's because 75% of our time is in the field. The workers are not in the office every day, and so it's difficult at times to communicate to the public that we have to go out and see people. During COVID, it was really a hard time for my workers, because my workers were intake workers. And they did not get to stay in the office. They had to still go out in the field to see people. They were able to do the phone assessment, to do the majority of the assessment over the telephone, but they still had to go out and have the documents signed and everything. And so it was very hard during COVID for my workers, because they were being exposed to different things. And, sometimes the mask doesn't always protect you. But I normally share the majority of my information about IHSS going to question and answer, because that's usually when I'm able to tell you exactly what it is that you want to know about IHSS. I can stand here and I can talk about IHSS all day long, but I may not give you the information that you really want to know about IHSS. So I know that there is going to be a question and answer period, and I'll be able to address whatever your question is at that time. So I'm gonna turn my back over to you.
Thank you so much. Very helpful information, and for all the work of the IHSS intake workers do, because as you just heard, the numbers are great and only growing, right? And last but not least, we have Zania Weisengars, who is the manager at Transform Health, leading CalAIM initiatives for LA County and fostering collaboration among providers, health plans, and community organizations. She's bilingual with over 20 years experience in public and private sectors. She specializes in program design, policy, and strategic communications. Vania holds a master's degree in social welfare from UC Berkeley. And with her, we also have Dr. Ahana Singh, who is a manager also at Transformation Health, leading CalAIM implementation efforts and cross-sector initiatives to strengthen California's health systems. She has extensive experience uniting community-based organizations health plans, and public agencies to improve care coordination and equity. Dr. Singh holds a Doctor of Education in Healthcare, Education, and Leadership, also has an MPH and Bachelor's in Neuroscience. Show of hands, how many of you have heard the word CalAIM? Okay, good. Fairly new, and I'm so happy that we have both of them here to talk to us more about CalAIM and everything happening in that world. Thank you.
I just wanted to start a little bit about talking about myself. We always approach everything from a human perspective and what drove me to this work. I am an immigrant from Mexico. And when I moved to this country, it was really hard to navigate the healthcare system for myself. And so that drew me to get a degree in social work. And I focused at the beginning of my career working with Latino women and their families that they're had cancer. Can you hear me? That they had cancer and they were at the end of life. There are a lot of them, and the reason why they were at the end of life was because they didn't get access in a timely manner to healthcare. So I work a lot at that time. I was in San Francisco. I work a lot with setting the infrastructure to help them with collaborating with several community-based organizations, as well as with San Francisco General at that time. So from a personal perspective, I was the caregiver to my dad when he had cancer, and what complicated is that he was living in Mexico. So it also took a lot of going to Mexico back and forth. So I really understand, how draining can it be to actually be a caregiver and how difficult can it be. And so thank you for this opportunity and thank you for coming to this particular panel to talk to us. So I'm going to talk a little bit about who we are. This is our team. Alexis Taylor couldn't come today, but we work for a small women's owned minority company, a firm that is based in Sacramento, because we do a lot of transformation and we really want to change the system. So we work with policy. We are based in Los Angeles. We were entrusted by the Department of Healthcare Services to actually contract to be facilitators and help implementers of CalAIM that we're going to discuss in more detail. But we actually work in 3 different regions. We are in Los Angeles, Sacramento, and Central Valley. The program CalAIM is throughout the state, but those are the areas that we actually have the contract with the Department of Healthcare Services. So what are we going to cover today really quickly is really what is CalAIM, because some people have heard about it, a lot of people don't know what it is. And what are the 2 key services? And Reina spoke a little bit about ECM. So, and then it's community supports. And then the most important aspect is if you have medical, how can I access these services? So what is CalAIM? This is a program that got launched in 2022 and is really advancing innovation in medical. So we call it medical transformation. And it has been a lot of investment from the department, from California, as well as federal waiver money for actually being able to set up this, because it's really changed how we think about services that medical provides. Traditionally has been only physical illness, and now it really has expanded to really think about everything is interconnected. So it's about support too. So what we call it the whole person care. We are not isolated from what is happening in our environment. So how can I get better if I have diabetes, if I am about to be homeless? So this addresses how can we provide that support of housing, food, and other health-related needs and mental health for beneficiaries that are in a really vulnerable population. So there is some eligibility criteria, but that's the whole concept of whole person care. And simplify how to improve care coordination. So you don't have to go to 20,000 people and make 20,000 phone calls to get what you need, as well as really, which is close to myself and Hannah's heart, how can we advance equity and justice in the healthcare system so we all have equal access to healthcare and really strengthen partnership. This is the first time for a program like this that it is coordinating with managed care organizations like HealthNet, Blue Shield, LA Care, and providers and community-based organizations that they now have an opportunity to contract for their services with managed care organizations. I'm going to go really fast on this one because I already covered two of them. But what is Hannah's and I role in Los Angeles? So we are conveners. So we convene all of the providers that offer all of these services. We have events, we have monthly meetings that we talk to all of the providers as well as we stay close to the Department of Healthcare Services, really understanding all of the policy guides that honestly is very hard to read and understand. So we go through them. We have a policy team too that really sorts through that, but we translate that to actually all of the providers that are implementing all of these services. So community-based organizations that offer medically tailored meals or respite care, which is very close to what all of you may need. And we also identify what are the challenges and communicate it back to the Department of Healthcare Services. So CalAIM has all of these initiatives, but the ones that we really focus on is community supports and enhanced care management. So this is just, I'm going not to bore you with all of the numbers, but the point of this that it has been increasing more and more. A lot of people haven't access these services for lack of knowledge that they are available, including community-based organizations or individuals. So it is really important for us that we know that they are increasing because we want them to continue. So the Department of California and the Department of Healthcare Services really needs to evaluate, is this working, is this not working? And one of the key things that we saw is that consistently has been increasing. So like for ECM, which I will cover in a little detail, we got almost 150,000 just in the Q4 of last year. And we community supports, there are services providers, almost 1 million. And there is strong community engagement. And a lot of providers have been able to contract with managed care. And by providers, I don't mean just clinics, I mean housing, meals, respite care providers, home modifications as well. And we are proving that this is cost effective because as we spoke, all of us, you want to stay in the community. I don't know anybody that says, please bring me to a nursing home. You want to stay in the community. So how we can provide better care with less cost. So the next is what is enhanced care management? So it's a very simple but really helpful services. So for members of medical that have complex needs, and by that could be what I just described, the example like I have mental health issues, or I have diabetes, I am housing secure. How can I, get all of those needs addressed so I can also be healthier? So with this plan, you get assigned a lead care manager that is called LCM. They love acronyms, so forgive me, but it's a care manager that gets to know you and helps coordinate all care services for you, but connects you not only with a clinic, wherever you go. If you're in a clinic or you are talking to a social worker, they can help you connect with other services. And it's really extra help. And this is not instead of medical, no cost. There is no cost to the members. It's part of your benefits of medical for those who are eligible. And the eligibility is really vulnerable populations that have complex needs. So how can a lead manager do for you? Really, they can give you They can arrange for rides, medical care. They can arrange for coordinate care after you leave the hospital. Where am I going to go? If I still need care, if I still need like help with daily living, chores. So they help you really adjust all of that and connects you with that. So it has a lot of different aspects from health promotion to outreach, because one of the things is really going where the beneficiary is not you have to come to us. It's like we can go to you. So it has a lot of different components, including member and family supports for the members that have a caregiver. So it takes into account also the support that they need. And then who qualifies is always a really long list, but there are some areas that we call population of focus. So it's children and families that experience homelessness or are housing secure and they may become homeless. It's also people that are at risk of being hospitalized or are at an emergency department, but they really don't need to be hospitalized. Adults and young children that they have serious mental health or substance abuse issues, living in the community, at risk of being in long-term care. So it's a lot of different aspects. Also, there is a focus on helping members that are living, that are incarcerated, or youth that are in foster care to access medical first and then to really access these services. So we call that aspect justice involved, so they can become also part of the community. And then there is also a focus on birth equity, meaning that it really helps pregnant women that are in vulnerable situations and have complex needs to access that care. And with that, I'm going to pass it to Dr. Singh to talk about community supports. And then we'll stay and answer questions if you have them. We also distributed this flyer. So this is more explanations, and she's going to talk more about how to access care.
Thank you, Danya. Hello, everybody. I think I'm the last presenter here, so we're going to end it with a bang. My name is Ahana Singh. Hello, everyone. Zoom, everyone on Zoom. Hello, hello. Again, my name is Ahana Singh from Transform Health. My colleague Danya and myself were managers here at Transform Health. So just again, calling out the little one pager you have in front of you. If you don't, please raise your hand. We'll come around. And pass it out. Okay, we see a couple of hands over here. Okay, we'll make sure that you'll get that. Just to call it out, before we get into community supports, this one pager here kind of talks a little bit. It's a checklist talking about ECM, enhanced care management, and community supports, and talks about exactly what it is and what kind of help you can get under CalAIM, right? So ECM that Danya just talked about, and community supports that I'm going to talk about right now. Okay, so this is kind of like a one pager you can take as a resource. So this is here for you, and we're going to talk about community supports. Okay. All right, community supports. What is it? Danya talked about CalAIM. What is CalAIM? California Advancing and Innovating Medi-Cal, which is a huge umbrella term, right? Under CalAIM, we have different buckets. One of them being enhanced care management. The other bucket is community supports, or CS in short. Right, so what is community supports? Community supports is areas of additional services available through Medi-Cal, again, right, it's under Medi-Cal, that help caregivers like yourselves and members manage health-related needs, manage care at home, prevent the needs for more expensive or intensive care. This pretty much means that it covers all the needs that a member has that is non-medical related, but also contributes to the overall health and well-being of the member. So these are some examples here. So under community supports, these are some of the things that are included: stable housing, and the next slide also explains a little bit more, including deposits, healthy meals and groceries, MTM. MTM is medically tailored meals, MSG, medically supported meals, or medically supported groceries, repairs making your home safe, like asthma and breathing, that is also included, very important. home modifications for safety and accessibility, right? Moving around, like adding pools and bars. And so this is important to know. So these services are available and eligible for Medi-Cal members, regardless of whether you qualify for ECM. So again, CalAIM is a huge umbrella term. ECM, community supports are different. Regardless of whether you qualify for ECM, you will still qualify for CS, okay? So talk to your managed care plans. You're here in LA County, there are 6 of them. There's Anthem, Blue Shield, Kaiser, LA Care, Molina, oh my God. I'm missing some. HealthNet, yes, okay. Thank you. Okay, 6 of them. So yeah, different counties have different managed care plans, but here in LA County, there are 6 of them. So talk to your managed care plan. Okay, again, I kind of referenced this earlier. These are the general health related social needs supports. On this bucket here, and then this other one here on that side is homelessness, housing risk supports, okay? So here we have, for example, respite care, assisted living facilities, ALF, community home care, and all of these, again, are included under community supports. Not exactly directly related to medical care, healthcare, right? But this overall results in overall health and well-being of a person. On the other side, you have housing related. So housing transitions, navigation services, housing deposits, housing tenancy and sustainable services. These first 3 things are called the housing trio. These are included. Housing is huge right now. So these benefits are included. Rehabilitation, recuperative care, also known as medical respite. Short-term post hospitalization housing, can say that 10 times fast. New transitional rent. Again, all of these amazing benefits are included under community supports. Like, and they're not even part of ECM, they're completely separate, right? So they're all included. Okay. So, okay. Oh wait, what happened? Are we going back? Okay. Okay, so launched in 2022, Medicaid transformation, also known as Advancing and Innovating Medi-Cal, CalAIM, we already talked about this, is a groundbreaking multi-year initiative, right? This is kind of like a recap that we had. So the CalAIM community supports and health caregivers, and these are some of the checklists that we have here. Respite services. Okay, this is what it means. Providers provide short-term relief for caregivers while ensuring the members receive care in a safe environment. Helps prevent burnout and supports of a caregiver's well-being, right? Supports all of you as caregivers. This is very important for you, your health, your well-being. Personal care and homemaker services. I think we can all benefit from this, right? Offers help with activities of daily living such as bathing, dressing, meal prep, cleaning, reduces the physical and emotional stress of caregivers. Right, if you're helping somebody, a family, giving care to somebody who needs, who has access, functional needs, this might come very handy for you, right? Excuse me, let me grab something to drink. On this side, environmental accessibility adaptations. Okay, so this one here, home modifications, that's something I referenced earlier, covers home safety improvements like ramps, grab bars, bathroom modifications. Makes the caregiving at home physical environment very accessible and safe for living. Recuperative care, again, it's called medical respite. In other words, it's temporary housing for members recovering from illness or hospitalization and don't have stable housing. Right? And this provides caregivers to restore coordinated long-term care. And then last but not least, we have medically tailored meals or medically supported groceries or food, MTM or MSG. And this is really cool because this actually delivers cooked meals to your doorsteps. So think of like frozen meals and boxed up to your doorsteps. Anybody had like Blue Apron or something? It's literally like that. Mom meals, yes, mom's meals, yes. There's so many of like great providers like that. delivered to your doorstep. So if you have somebody who, let's say, is diabetic or has some health condition that excuse me, has restrictive or dietary requirements. This is really cool. Sorry, my throat is getting really dry. Okay, so how do you get more information? This is important. If you're caring for somebody on medical and have questions on CalAIM in general, please reach out to your medical plan. So again, talking about all 6 of them in LA County. They will confirm eligibility and tell you all the things you need to know. And this is another cool resource that we have. This is our directory that Danya and I and our team at Transform Health created. If you can just scan this code, it will take you right up to a spreadsheet that we created with all the providers in all different ASPAR regions that we have. It's literally a spreadsheet with different providers with different needs that they have. So let's say you're looking for a provider that provides housing services. That will have its own little tab. You can look at the different SPA regions. Again, LA County is separated into 8 different SPAs for service planning areas because LA County is so big. You have to separate in different regions, right? You're able to look at the provider in that region. Let's say you're in SPA 3, which is at Gabriel Valley. Let's say you're looking for housing services there. You can go to SPA 3, look for housing. You're able to see all the providers in SPA 3 who provide housing services. It's a really cool tool. Yes.
Just an FYI, I just scanned the code and it won't let me open it. It says it's restricted by the host organization.
Okay, thank you.
Oh,
We're having some issues, so now.
This one?
Yes. Oh, you don't. Oh, that's good. Yeah, and it's better to look at it in a laptop, in a bigger screen. It's not really made to look at it, but yeah, we can show you. Yeah.
You guys have another question?
Yeah, I scanned the code and I got to the spreadsheet.
Oh,
It worked for you? Okay.
Yeah, it's so
Okay, so I see that we're having, some folks are having issues in this room. If you're facing an issues accessing, please let us know after this presentation and we're able to manually add you in. Thank you so much for raising that. Okay. But again, this is a really cool tool. We put in a lot of time and effort into this, so please use it. It is here for your use. But yeah, more to come. And every month we update it, so there's more and more providers every month. So if you're in SPA 3, SPA 1, whatever, you're looking for resources or for referrals or coordination, this would be your tool to go to.
Excuse me, so it says
Yeah.
it has exceeded the monthly scan limit. So
Yeah.
many people have scanned it, you need to increase your capacity.
Oh, wow, this is definitely a good problem to
Okay.
have, but we'll definitely figure it out. Thank you.
Thank you for flagging.
Yes, another question.
That my father had Kaiser and he was referred to these services
Oh,
and I did get respite. And we were offered like 300 and some hours a month.
Really?
I mean, for the whole year. And if we run out, they can give us another 200 and or so. And if you run out of those, they give you another 90 hours.
That's great.
So it's really a really good.
How did he got the providers, guys refer?
Kaiser
Okay,
referred him.
yeah, okay.
thank you so much for sharing that. Amazing. Yeah, community supports y'all. I mean, it's amazing. All right, so this is us. That's Danya and myself. This is our information. If you have any questions, please email us. This is our inbox, the LA Path at Transform HC, and this is our individual emails. Please CC us. Otherwise, sometimes we get a lot of emails, so it gets lost in our inbox. But yeah, if you have any questions, we'll be around after this presentation. You can talk to us. And again, thank you all so much for having us. And as one caregiver to all of y'all, I used to provide care and take my grandma to her appointments back and forth. And she doesn't speak English, and having to translate things to her and like to her providers back and forth. I know it's a lot of hard work and a lot of time and effort you're putting into it, a lot of energy and emotional support. So I look to all of you and you're doing a lot of work, and thank you for all that you do. So we see you and we're here to support you. So thank you so much.
Thank you.
Thank you, Ahana. Can you hear me?
Yeah, this is.
Can you hear me?
Yes.
Thank you. So we had a chance to hear from MSSP, from IHSS, and now CalAIM. And all of you here as family caregivers, you know, one of the things I often hear as one of the family consultants on the team at USC Family Caregiver Support Center is the time. There's not enough time to make all those calls. There's not enough time to do all that research. There's just not enough time to drive them from point A to point B, especially if you're working, if you're caring for a young family. You have some of you have schools, some of you have spouses. I mean, it is not easy. So why not take advantage of all the resources available? If MSSP can enhance the support you're already getting, why not try it? IHSS, you know, maybe you've been awarded a certain amount of hours, but somebody just came out from the hospital and their need has increased. So maybe seeing if they can get reassessed. And in the meantime, also reaching out to the health plan to see if they can step in while IHSS comes back to do a reassessment. For CalAIM, a lot of people have heard about it, but a lot of people still haven't. And those 336 hours are diamonds because they can help you. They can help you and they can help the person you're caring for. They can help minimize your stress. They can give you added support. And that's just one. A lot of the things I also hear is the time to cook. Well, how nice is it if they can deliver a meal already made? And all you have to do is heat it up. Sometimes people like it and sometimes people don't. But give it a try. You might be surprised. One of my clients is 88 years old and she's helping care for her sister who's all 89, 90. They're around the same age. Her biggest stressor every day was figuring out what was she gonna make for food? What was she gonna cook? Well, because they were both older adults, I was able to connect them to their local senior center. And now they get home delivered meal through their local senior center. And that's also a different option. So there are resources. Connecting with programs like theirs can really help. I know some of you may be a little frustrated because you're like, well, I don't have Medi-Cal. How do I get Medi-Cal? I have a share of cost. What do I do with that $1,500 share of cost? Well, there are resources. I encourage you to talk to HICAP, the Center for Healthcare Rights. They're outside. They can help you manage some of the share of cost questions. DPSS, for those of you that you know are a couple and your income is a little higher, sometimes there's a way that you can get that through a different program so that you can get that reduced or waived. So there are ways. Continue to ask because there are changes all the time. So just keep asking, keep knocking. We have been time for a few questions. If anybody wants to ask questions of Ms. Andrea pertaining to IHSS, Reina regarding MSSP, or Ahana and Danya regarding CalAIM, please, this is the time. Janice? Yes.
My mom, we're new to.
You need a
IHSS.
microphone, just 1 second.
Oh, I'm sorry.
That's okay, so she can hear you.
I already knew. All right. Sorry about my voice. So we're relatively new to IHSS. My mom's 92. And so we just started doing the timesheets and everything. And my mom fell in September, cracked 3 ribs, inpatient, or not, she wasn't outpatient. So if she's inpatient, that affects my time of her care, right? So she was outpatient but she needs additional care. She cracked 3 ribs.
Right.
So how much time because I'm like, you know, we're trying to survive in this new care environment for her. It's much more intense. So how much time do I to contact you? Do I need to do it immediately? Or can I contact now since it happened in September and
Is she home?
she's home? Yeah.
Okay, so once she came home, you could have called us at that time, but you can still call us now. We can't go back, but we can start it from now. If she needs extra time, we will assess what her need is now Because we assess by the need, we don't assess by the condition. We assess by what she can and cannot do for herself. And so if she was able to ambulate before she fell and she can't ambulate now, then we can assess you for additional time for that. And it would start the day that you call. So I would say call Monday.
Okay.
And leave a message for your social worker so they can, because it's probably in approved now. The approved workers do not take calls directly. You have to go through the call center for the approved workers. The intake workers, they take calls directly. So I would call the call center and you have to wait on the line. Don't hang up. Because it may take a while before you get through. But you will eventually get through. So stay on the line. Leave a message for your social worker to call you back. If they don't call you back within, I think they have like 5 days. If they don't call you back within the 5 days, then follow the chain of command. But you can get additional time if she needs additional service. Okay.
Thank you. Time flies when you're having fun. I am receiving a signal. It is time to end the session, but I thank you all for being here. Thank you for making the time. Congratulate yourself for dedicating this day to you. I hope that you are enjoying it. I appreciate you. For those on Zoom, thank you for joining us. We appreciate you.
We're going to end the, I'm sorry.